Across the nation, all 50 states have reported and continue to report cases of COVID-19. And while different parts of the country are experiencing different levels of virus activity, doctors everywhere are learning more about the potentially deadly disease every day. Joining me now on Skype from New Hampshire is Dr. Jonathan Ettinger. He is a cardiologist and fellow of the American College of Cardiology. That is, he is affiliated with many hospitals in Manchester, including Catholic Medical Center. Doctor, welcome. Thanks so much for joining us.
Yes, thanks for having me, Tracy.
Well, there's so much that we're still learning about COVID-19, but we know that people with underlying health conditions may be more at risk. Is heart disease considered one of those conditions?
Yes, heart disease is, but right now we're so early in the pandemic that we don't have a good sense of what types of heart disease are more at risk versus other types of heart disease, which might be less risk. Right now we have a broad idea of risk, but I think we're waiting for more information.
I know that we're hearing that a lot of people may be asymptomatic and that they can spread the virus without even knowing it. How concerning is that to you as a doctor, especially when it comes to stopping the spread of this disease?
Yeah, because we're so early in this process, there's a lot we don't know about the virus. So it requires social distancing, the 6-foot rule, hand washing, general principles like that to keep people safe. Because without that knowledge of if I'm infected or not, it's very difficult to then know if you're going to infect somebody else, right? So it's challenging. So right now, it really behooves the public to do the right thing and stay in and non-essential travel, those type of things.
Yeah, I mean, this has hit absolutely everywhere. What are you seeing in your state, in New Hampshire right now? And can you tell us how it's impacted hospitals so far?
Sure. So we're just starting to get into the surge, I guess. It's coming. This week we've really started to see a surge in the numbers. Our hospital, Catholic Medical Center, had our first deaths this week. So it's been particularly traumatic this week and stressful this week. We knew this was coming, but it's just hard to prepare mentally. We prepare as much as we can in the hospital with resources and planning, but that first death has taken a lot out of the staff. Yeah.
Yeah, it's really, really tragic. Have you ever seen anything like this before? I mean, have you ever been in the middle of an epidemic or pandemic like this?
You know, we see rises and swings with the flu. And I was part of the flu in 2003, 2002, 2003, but this is nowhere near this is much more severe than what we saw back then with the flu. This will probably be, for most clinicians, this will be their crucible, and most patients, this will be the crucible of their generation. It's unprecedented, and it's distressing. It's very difficult.
Yeah.
This will be the highlight of a lot of physicians' career, and I say highlight with trepidation. Yeah.
I know that there is a big lack of personal protective equipment, also known as PPE, right now for healthcare workers. Are you experiencing this at Catholic Medical Center? And if so, what's the hospital doing right now to try and fill that gap?
So we've had a lot of generous donors from the community. Our hospital's been able to make some purchases as well. Our leadership has really worked hard to keep our supply chain and our supplies up to speed. Again, this gets at what we were talking about before with people staying home and just trying to suppress the virus, and so we never have to use this supply. It's one of the reasons why we're not testing people regularly. We're only testing if you're symptomatic or if I think the test is going to make a difference. We're only bringing you in the hospital if you need to be hospitalized. There's still some confusion out there about who needs to be hospitalized, who needs to be tested. But all of that is geared towards allocation of scarce resources and trying to keep the numbers, our supplies up in case we really need them.
Yeah, I know that you're a really busy man. I don't want to keep you, but I really want to ask you this last question. As a Catholic physician, how is your faith helping you to face these new challenges that are coming up from this pandemic?
Sure. My faith is important. It's part of my strength. It's part of my character. It's part of why I work at a Catholic hospital, is because I can incorporate my faith in taking care of my patients every day. we have something simple that comes across our work email. It's a daily prayer. It's just a simple message, but oftentimes it provides hope and inspiration and reminds you of why you're doing what you're doing. So I find a lot of faith, a lot of inspiration, and I get my courage from my faith.
Well, Dr. Edinger, thank you so much for what you're doing. We're grateful. We're praying for you and all the medical workers out there, and know it's a really tough time for you. So our prayers are with you. Dr. Jonathan Edinger, Catholic Medical Center, thank you.
Thanks for getting the message out.